Hello and welcome to this webinar. I am Dipendra Manocha, founder trustee Saksham, welcoming you all to this webinar on access to health services for persons with disabilities and specifically for persons with blindness and low vision. Um, this is a session where we, especially during COVID time, we have seen that there have been a lot of challenges that persons with blindness have been facing with regards to taking medicines or access to medicines, whether identifying the correct medicine or taking their crucial readings of the crucial parameters like oxygen levels, temperatures, etc., or even insurance, etc. All that have been certain issues for which we have been faced. What we thought about was that we had certain interaction with the Niti Aayog and Dr. Vinod K. Paul. He actually, with him, we decided and we planned this webinar where we would actually try to identify what are the challenges, what are the legal provisions, what are the possible solutions, and then sort of this webinar is supposed to be a starting to to a to our efforts towards finding solutions, whether they are long-term or short-term solutions. But we would definitely have a roadmap on how these challenges can be overcome. And with the Dr. V.K. Paul, of course, is the member of the Niti Aayog. He had verticals on the health, nutrition, and human resource, which are very relevant to this topic. He has been the head of the pediatrics department in AIMS. From there, he went on to Niti Aayog and was associated with several initiatives of Government of India, including Ayushman Bharat, and currently, of course, leading the struggle against COVID of the country. Unfortunately, he is, with this Omicron, etc., coming up, these extraordinary circumstances, he is not able to join us live today, but he has sent a message to us, which I would request Nishtha to read out to us, a short message that we have received from Dr. V.K. Paul for this particular occasion. Nishtha?
Yes, sir. Thank you. So, Dr. Paul has written, Dear Shri Dipendra Manocha ji, I am pleased to hear that Saksham Trust, with support from Amway India, is organizing a webinar on accessibility of health services for persons with blindness. This is a very important societal issue for the welfare of Divyangjans. I would have been delighted to participate in this event. However, due to unforeseen state visit on priority, I regret my inability to participate in this event. Invite deliberations with me at Niti Aayog. Happy to hear your views in this and assist in planning a way forward. Thank you.
All right. Thank you, Nishtha, who's a colleague at Saksham with us and sharing this important message from Dr. Paul. Of course, it's understandable that he's tied up and his priorities are to attend to those exigencies and urgencies. But having said that, we actually thank Amway India Enterprises Private Limited to support us in this endeavor of holding this webinar of such importance of today. We acknowledge presence of Mr. Raj Narayan and from Amway, and also the Vice President and special guest, Dr. Rajat Banerjee, who is also with us today and will be sharing their thoughts. We acknowledge presence of and welcome Dr. Anil Aneja, President of All India Confederation of the Blind, Dr. Sanjay Jain, who's the principal of the Law College, Pune University. We are also would like to extend our special welcome to our honorable guest and special guest, and who's also now stepping into being the chief guest of this event now, in the absence of Dr. V.K. Paul, Mr. T.D. Dharyal, who I think whole of this fraternity knows very well of his absolutely immense contributions as the very dynamic Commissioner Disabilities, the NCT of Delhi, and his work, long-standing work, and his as the Deputy Chief Commissioner also in the central government, plus his consultancies these days on in a committee in Niti Aayog, plus with UNESCAP representing India. But uh, we may also like to acknowledge presence of Professor Rao, Professor Madhusudan Rao from the Design Division, IIT Delhi, and also Professor Balakrishnan, who has also joined us from IIT Delhi from the Computer Science Department, on ex-Deputy Director of IIT Delhi. Of course, they're like a family, and welcoming them to this event here. Dr. Piyush Chanana, of course, will be presenting with us, and he's a colleague, and he will be making some presentations here. With that, I think what let's have the ball rolling for and inviting Mr. Anil Aneja to actually throw light on the key challenges from the user community. What are the key challenges that we all have been facing, and the voice of the users is coming to us through Dr. Anil Aneja. May I invite Nishta again for reading the for introducing Dr. Aneja before we invite him to speak.
Thank you, sir. So Professor Anil K. Aneja has a long and distinguished career of more than 30 years in academics. Presently, he is currently the head of the Department of University of Delhi. His areas of interest include 20th century fiction, disability studies, Indian writing in English, translation studies, human rights literature and communication, and technology applications. He has written significant number of books. Professor Aneja is also the nodal officer as well as the grievance redressal officer, persons with disabilities, and officer on special duty at the Equal Opportunities Cell, University of Delhi. For nearly 25 years now, Professor Aneja has been actively involved in the disability sector in various national and international roles. Presently, he is the president of the All India Confederation of the Blind and has been the chair Rehabilitation Committee, World Blind Union from 2016 to 2021. He is the chairman of the governing body of Zakir Hussain College, University of Delhi. His achievements have earned him several distinctions from various quarters. Professor Aneja was conferred an award for empowerment of persons with disabilities by the President of India in 2014. In 2017, he was presented with the Achievers Award by the Indian Eye International Human Rights Observer. He was also conferred the State Award in the category of the Best Individual Working in the Field of Social Work by the Government of NCT Delhi, and the prestigious Rustam Mirwanji Alpaiwala Memorial Award 2020 by the National Association for the Blind. He was also conferred the prestigious National Award 2019. Thank you, sir, and welcome. Over to Kendra, sir. Over to you, Mr. Aneja.
Welcome, Dr. Aneja, and please over to you for your address.
Thank you very much, Dipender and Nishtha, for giving me this opportunity to be with you this evening on this very important yet very neglected area as far as persons with disabilities are concerned. And I'm thankful to Saksham Trust and its partners, Niti Aayog, Amway Opportunity Foundation, for, I hope I'm audible and visible, Nishtha?
Yes, sir, you are.
Yeah, okay. For considering to have deliberations on this topic so that a way forward could be worked upon. to ensure a better world for persons with disabilities than it has been so far. I'd like to begin my submissions, which I'm told should be brief. I think 8 to 10 minutes, Dipender. Is that the time limit?
Yes.
Professor.
Anil, Professor Aneja, just a small thing. Can you move your camera a little upwards? Your face.
Upwards, yeah. It's on a pen drive, but I will try to see. Is it better now?
Better, sir. Just little. No, now it has gone down. Move it up. Yes. Now, sir, it's okay.
It's fine. It's fine.
Yes.
Yeah.
Yes.
Yeah. I'd like to begin my submissions by mentioning 3 incidents, which in my view would highlight various dimensions of the challenges that a person with disability would face, or generally faces, as far as health services are concerned, in various roles. When I was a small child, we had a dispensary in the school, and a doctor used to come. And whoever was not well, the doctor would give some tablets, which we discovered were very similar in nature for everybody, irrespective of the illness. And we didn't know what those tablets were, or whatever concoction it was. Sometimes it worked, sometimes it didn't. The point was, there was no need felt for the medical practitioner and the institution even to enlighten the child as to what the ailment is, what medicine is working. And I strongly feel that there was no need felt by the doctor to even do much variation in the medicine. I also may believe that sometimes the medicines were also expired because they were all brought in as by way of charity. And I have reasons when I'm making such a statement. This was a neglect. Last year, around the same time, when my wife was in the hospital and fighting a knife and death battle, it was a government hospital with the best of facilities and best of context that one could have in that institution. Even then, I faced severe challenges as far as looking after her was concerned, because the hospital required one person would be there throughout who would run pillar to post and aim to the hospital if anybody has an experience with that, which doesn't distinguish between anyone, and the procedures are same. Pillar to post, buying medicine, getting various procedures done. Even if the patient is the ICU, you have to go, we have to make the payments and various counter, everything is a different place. It's a highly inaccessible place, despite the fact it's a premier center government hospital of the country, perhaps the best in the country. But as far as accessibility is concerned, it's lacking. So there was a severe problem, and one had to pay someone to be around to do that for something which a person with disability could easily do. Yesterday, when I had to order medicines, my maid suddenly told me that medicines were over. I didn't have the prescriptions. My doctor had instantly changed the medicines, so I didn't remember them. I had difficulty ordering because the prescriptions were not at hand, so I couldn't even WhatsApp that to the chemist. The point I'm trying to make is that basic, we are told that healthcare is a right, and that is a fundamental right. It's taken so much for granted in the case of persons with disabilities that nobody even pays attention to the fact that a person with disability may have difficulties which are not experienced by other persons and does require support. Hardly any NGO is even doing any project in healthcare, an NGO which is working with persons with disabilities. So it's very easy to look at the policies and say this is the problem. It's very easy to look at the infrastructure and the delivery mechanisms and say this is the problem. My point is, it should be very easy for us also to look at our own selves and realize that there is a problem. The very fact that we have not talked about it, organizations with visual impairment have not engaged with it, itself shows the desperate need persons with disabilities are as far as healthcare, accessible healthcare is concerned. Having demonstrated that, my next point would be what is accessible healthcare? It's a very broad term, generic term, accessible healthcare. When we say care, we must realize that a person with disability has to do healthcare in various roles. It may be for himself or herself. It may be as a mother or a father. It may be as a husband or a son. Roles are different. It may be healthcare also in your institutions when you have to look after others if there's a pandemic or something of that kind. So, concern the person himself or is incorrect. That requirement of the person with disability should be in sync to his or her relation with the environment. When we do that, we realize that there are problems at the level of policy. There are problems at the level of delivery mechanisms. And there are problems even at the level of home care and home maintenance. When we talk of policies, there are two specific policies that I should refer to. The National Health Digital Mission and Ayushman Bharat. We are familiar with them. We all talk about these in very generic terms. But look at the policy document, hardly any references there to persons with disabilities, realizing that if you talk about digital mission, special accessibility would need to be built up into any digital database or any digital backbone, which may need to be created in the National Health Digital Mission. But those provisions are not included. There's a very strong need to do advocacy and lobbying to ensure that all the apps, Arogya Setu app, when it was not accessible, AICD, my organization had to in fact lobby and do a lot of advocacy to ensure the accessibility of that app for iPhone users. And it took a lot of time. Much of accessibility was achieved afterwards, but with a lot of effort. The point is, when a government, digitalization are very good and I think can serve as a boon as far as accessibility in healthcare systems for persons with disabilities was concerned. I was talking to Sriki yesterday and she was suggesting, why don't doctors give WhatsApp prescriptions? It's a very good idea. If we are talking of National Health Digital Missions, these are the kind of things that we should be inbuilt. That all services under the National Health Digital Mission, which are built up, should be, or all healthcare services for that matter, should be available to persons with disabilities in accessible format, whether it is hospital prescription, whether it is website a booking of appointments, whether it is information regarding various companies, medicines, etc. There should be a very concentrated focus drive. Just to say for all is not going to work, because when all doesn't mean everybody actually. See, we all know by now. And what about things like going to hospitals? The digital mission may not take care of that. When a person with disability goes to a hospital on his or her own, how does he negotiate an unfamiliar environment? Asking, and remember, the hospital has many barriers. There may be equipments on the way. There may be patients coming. There may be other kind of barriers, crowds and on that. Is there a problem directing every hospital to ensure that there are dedicated numbers and volunteers so which a person with disability can contact before he or she is coming to the hospital or is coming, and they can take him from the door, as it happens to an extent, not fully, at the airlines, and then look after all his or her needs in the air. This is what happens in a country like UK. I have a close friend in UK who's visually impaired, India. The couple is Indian, settled there. And they said they don't have to depend on their son for any healthcare services. When they book a service, the vehicle will come, take them, and the person would stay with them till the healthcare needs are fulfilled. There's no problem. We will get enough volunteers in the community. Many people in the system, in the hospitals, etc., can be used additionally as volunteers, additional work for this purpose. Numbers can be displayed. These can be well circulated through the UDID and other databases to persons with disabilities. If in the pandemic, the 5,000 rupees or 1,000 rupees, whatever that was, can come in the accounts without asking, why can't this kind of information also be generated and come to persons with disability? So at the community level, at the policy level, at the delivery websites, etc., level, there is need to ensure complete focus on accessibility by specific mentioning and by specific chapters and provisions in every document. Professor Sanjay Jain is going to talk more about this. So I'm not talking about RPD Act and what are the provisions which are there. I'm sure he will be focusing on those. But as far as the actual delivery is concerned, there's much to be done as far as accessibility of digital mission is concerned. Similarly, in Ayushman Bharat, the criteria of income-linked insurance, which is a big drawback for persons with disabilities. So one advocacy point could be that all persons with disabilities should be covered in the Ayushman Bharat scheme, in insurance scheme, irrespective of their income, because there is the whole idea of poverty associated with disability, and there's a cost to disability also, which is not often factored in the income of the individual. So this is one thing I would like Saksham about. These 2 points I would definitely like Saksham to address. The accessibility of digital mission infrastructure and backbones, and frontal faces, and also persons with disabilities be included irrespective of income in Ayushman Bharat. Voluntary services in the community volunteers at the hospital level. And last of all, I know my time, I'm running out of my time, the accessibility of medicines. When my wife passed away last year, one of the things I asked Dipender is how to make medicine accessible. He gave me some medicine box. I could divide that. Why can't we have a QR code based medicine system, which we can scan, but not everybody may have a mobile phone and a scanner. So writing on brain, audio chips, these could be some of the ways, and also obligation on chemists to ensure that provide proper assistance while buying medicines to a person with disabilities and segregating them in different envelopes, covers, labeling them, helping them, and the vendors itself, but that should be legally binding. And then home care. Home care services are much in vogue these days. Insurance companies are also covering, but too expensive for persons with. So again, the need to build up community volunteer networks. So much needs to be done. These are some of the important points. There's much more one can say. There's no point repeating the challenges. As I said, the challenge is bunty food. As a person, I suffer a challenge. As a caregiver, I suffer a challenge because my health is not even taken cognizance of while deciding anything in community and families in the hospital. And therefore, I would strongly urge that initiatives such as this should continue, should be strengthened by coming together. And our organization will definitely do its bit to do advocacy wherever possible, wherever required, to ensure better accessible health for all persons with visual impairment. Thank you very much. Dipender, I'm through.
Sir, Dipender, sir. Just wait for 1 minute. If he's having some internet issue, we'll go ahead. Okay. So thank you, Professor Aneja, for highlighting such important points. So these are very relevant and will definitely. Okay, sir is back. Sir, can you unmute yourself? Manoja, sir. You're mute.
Dipender, we can't hear you. Yeah.
I think there is some delay on.
Sorry, yeah. So there's some network connectivity problem that came up. But yes, I was just mentioning. I think I was completely muted or disconnected during that time. But yes, Dr. Aneja, thank you so much for this very important intervention. I think it's very, very thought-provoking. This is something which really inspires us to and makes it into an urgency to address all these issues. And it's not Saksham which is going to address. I think we will be happy to facilitate, but I think we all need to be working hand in hand together.
Together, yes, of course.
Sure.
We are always there with you. We are always there together, and we do more our bit after the webinar. Healthcare would be one of our focus advocacy areas. I commit that.
Perfect. With that, let's take this dialogue forward. I would like to now introduce our next speaker, Dr. Sanjay Jain. May I request Nishtha to please introduce Dr. Sanjay Jain.
Thank you, sir. Dr. Sanjay Jain is Professor and Principal Additional Charge at the ILS Law College, Pune. He has completed his LLB, LLM, and PhD in Feminism and Constitutional Law from Rashtrasant Tugtoji Maharaj Nagpur University. He has cracked the NET exam in 1995 and started his teaching on contract basis at the Department of Law University, Nagpur in 1996. He joined as full-time lecturer in law in Bharati New Law College in 1997. And since the last 11 years, he's at the Law College. An experience of 22 years and holds a number of key positions in the college. He was appointed as the country advisor in India in Accessibility of Streets project, which is funded by the European Research Council. The project is a cross-country of the disabilities involving 6 states in Africa.
Rovita, एक मिनिट होते connection गेला.
Sanjay, we can hear you.
Okay.
We can hear you. We can hear you.
Probably then we lost her connection.
No, please, Dr. Jain, please welcome and please.
Should I start then?
Yes,
Yeah.
yes, please. Yes, please, Doctor.
Yeah. I think thank you very much for very generous.
I'm very.
So should I start?
Sorry.
Nishta,
Sorry.
No problem. You have introduced me enough, I think. Thank you very much for a very warm and generous introduction. Right to health, basically I'm making a debut on this topic. And therefore I thought that I should take this up. And when I was looking at literature, I was astonished at the lackadaisical attitude of the government and its perfunctory approach towards this important right. Let me, at the very outset, say that at any rate, right to health as a human right is a very controversial proposition, because when we say that everybody has a right to health, it's very easy to talk the same. But what about walking the talk? Because who would spend the money, from where the resources would come? And therefore, characterizing right to health as a human right, as a universal human right, has always been a dilemma. And many scholars have in fact argued that it is a very naive proposition to characterize right to health as a universal human rights. But Jonathan Wolff, in his thought-provoking book, he has argued that even if there may be enforceable limitation of enforceability of these rights, there may be issues of, adjudicating this right in the courts. What about the moral connotation of this right? What about the moral contents of right to health? And then he, of course, has narrated right from Universal Declaration of Human Rights to Alameda Conference to ICE-SCR and so on and so forth. But the point which I want to make when I say all this is that right to health at any rate is a very controversial point. But what about the right to health of persons with disabilities? Because that is what we are supposed to discuss today, and of course with special focus on blind people. So when I read Article 25 and just opening part of the Article 25, you will realize the kind of importance World Assembly has attached to this important right. But whether this significance is rhetorical or whether it has been translated in reality is a matter of empirical study. is a matter of deep investigation. But let me quote from Article 25, and I quote, state parties recognize that persons with disabilities have the right to the enjoyment of the highest attainable standard of health without discrimination on the basis of disability. So highest attainable standard of right to health has to be enjoyed by people with disability, as the convention read. And when Dr. Anish was lamenting on the poor, sorry state of affairs, right from buying the medicine to segregation and how to make out what is the name of the tablet, etc., we realize where we are, right? Is there a yawning gap between cup and lip, as they say? Now let me expose the government of India here when they translate so-called, when they try to perform their so-called ratification duty under Article 27 of Vienna Convention of Laws of Treaties, because India has ratified United Nations Convention on Rights of Disability categorically without any condition, and still how they confer right to health. I have already read to you the opening part of Article 25. To time constraint, I did not read the whole article, but now let me give you the flavor of RPWD Act. What RPWD Act says: the appropriate government and the local authorities shall take necessary measures for the take appropriate measures for the persons with disabilities to provide free health care in the vicinity, especially in rural area, subject to such family income as may be notified. So look at the perfunctory way in which this right has been translated in the first clause itself. Appropriate government must take necessary measures to provide what? To provide free health care. But free health care where? In the vicinity of rural area, and that too subject to notified income limits. So plainly speaking, this section is a non-starter, because to commence liability under this section, government has to do a lot of things, including notification of income limits and establishing necessary institutions to provide free health care to the people with disability in nearby vicinity. But from where free health care will come? Where is the budgetary allocation? And the law is completely silent. Section 25 is completely silent. And see the wedge, see the tension between the two laws. What happens when a glamorous issue is taken up by Parliament? Now, mental health is a glamorous issue. So when you read Mental Health Care Act, and particularly when you look at Section 18, Clause 1, categorically it is provided that every person in India is entitled to mental health care, and the same shall be funded by appropriate government. And the same section, later in its later clauses, talks about budgetary allocation, and believe you me, the section runs into more than 600 to 700 words compared with the frugal language of Section 25 of RPWD Act. So the point which I want to raise by comparing and contrasting, first of all, the two laws in India, whether mental health care is more important than the general health care, or should we say that there should be a proper interface between mental health care and general health care? This is first point. My second point is, even if it is assumed that mental health care is more important because mentally ill people are vulnerable, what about people with disabilities? Are they also not equally vulnerable, and are they not equally therefore entitled to a decent right to healthcare, if not in terms of highest attainable standards? In my opinion, these questions have been left unanswered, not only in India, but even elsewhere. Look at the Trumpian triumphant expression. What Trump used to say, okay, who are ill, people with existing situations, they are ill. People with disabilities are ill, but the normal people are not ill because of pandemic. So we are already pushing, we are already giving a pushback to people with disabilities during the pandemic. We are already saying that if there is a shortage of ventilators, then there may be trade-off, and such a trade-off is morally tenable. You can give preference to called typical. However, from the standpoint of India, my whole point is, if any section of RPWD, if you want to critique in terms of social model of disability, then there cannot be a more important section than section 25. Read section 25, which I cannot read because of paucity of time. It runs like a sad commentary on medical model of disability, right? As if disability of every individual is located in body, and therefore by carrying out surveys or by doing investigation or by making early interventions, you can stop disability, or you can ensure that there should be less people with disability. There should be depletion in the number of people with disability. When you take such a position, you digress from the real issue. You digress from the barriers which are there in the way of people with disabilities. When you read the commentary on Article 25 on the other hand, and when there is a focus on prevention of disability, or if there is an obligation to ensure that whatever a little ability is retained by the person, that should be conserved, the focus is not on those who are not disabled, but focus is on the disabled. So if a disabled person has some sight, for example, if a blind person has some sight, then the obligation is on the state to ensure that he or she retains the sight. But here, instead of focusing on disabled, we are focusing on we are focusing on the issue of disability neutrally, and we are trying to ensure that all the budget is spent on preventive measures, on vaccination measures, on measures to investigate, to carry out surveys. My appeal would be, and my contention, my legal contention would be, we should challenge the constitutional validity of Section 25 of RPWD Act. We should very vigorously argue before the High Court or Supreme Court that the contents of right to health care of persons with disability must be brought on par with right to mental health care. We don't want to lose the broad contours of right to mental health care. We are happy that right to mental health care has been recognized in such broad contours. But then why shy away? Why don't government also recognize in similar broad contours the right to health care? I would argue that Supreme Court of India and High Courts in number of their judgments from time to time have repeatedly held that right to health care is not merely an intrinsic right in itself, but it is a right very integrally connected with right to life. In fact, when we talk about right to health, we are not talking about a state free from disease. We are talking about a state which is physically, mentally, and socially perfect. So, physical, social, and mental well-being is covered by health. Merely keeping the body free from disease is not what is meant by the healthcare in WHO sense, and also healthcare in human rights law standards. Anish was referring to Ayushman Bharat. I would like to conclude my observations by just quoting from Ayushman Bharat, one of the criterias which is laid down to avail the scheme in rural area. They say that if you are a disabled family, and if there is no adult able-bodied member in your family, if there is no adult able-bodied earning member in your family, then you are entitled to Ayushman Bharat scheme. There cannot be more hilarious criterion than this. First of all, why do you assume that the able-bodied bread earner of a family would essentially then necessarily take care of person with disability. So I endorse the point of view of Mr. Aneja.
Health for blind people.
Disabled in India itself is socially costly, and the social cost of being disabled has to be compensated. And I think
Listening to a webinar on that Dipender has organized on health for the
and I think the provision of right to health care can be strengthened in this slide. Thank you very much.
Thank you so much, Dr. Jain, and for this wonderful background and the legal aspects covered so beautifully of covering this aspect on accessibility to health services. Actually, we would now. I would also now would like to bring on stage and give mic to another colleague, Dr. Sriki Singh. She is also a professor at Delhi University, on bringing in some more aspects, because we just were speaking about, and her name was also mentioned by Dr. Anil Aneja, and because of her vast experience of trying to access health services, unfortunately for certain issues, she's had some experiences, and we would want to highlight issues here. So, Smriti, floor is yours.
Good evening, sir. Just 1 minute. I think now I'm audible and visual to everyone. Let me introduce myself. I'm Dr. Sriki Singh. I'm Associate Professor of English at Matrai College. And I'm really grateful to Dr. Dipender Manocha and Professor Aneja to giving me space in the completely, what I will say, yeah, of course, it is disabled, like it is visually challenged, and bringing point of women perspective, how healthcare system becomes problem for we women, you know, and what kind of situation we have faced during the COVID, regarding the COVID and everything. And whatever I would be talking on my personal experience basis only. I'm not quoting anything. I have researched over 100 girls, because when I faced problem, I realized this is big problem. Let me first of all tell you that I am mother for 2 kids, and my child is suffering with temporary disability. Maybe we are getting her treatment for critically like disability orthopedic problem. Okay, and she has gone for surgeries for several times. And I never realized, like all the doctors, they used to write medicines to me. Being a caregiver in the family alone, I used to take my child to hospital. Doctors will write medicines. Doctors will tell, ye de dena, ye kar dena, jaise karna hai, matlab do it. Whatever. I could not even understand severity of disease or what is disease. Till the time I met Dr. Matthew Vogis. Let me thank him for this, for making me realize about it. He said, I'm very sorry that I cannot give you WhatsApp accessible prescription. I said, means what? You want? He said, do you use WhatsApp? I said, yes, I do. He said, then I should give you prescription on WhatsApp as well. So he started giving me prescription on WhatsApp and started explaining me disease, first of all, for my child and everyone. So that way I understood what was the severity of the disease. And during the COVID, when we were sick, we did not have anyone to check us, you know, and as you know, hospitals beds were not so easily available. And I was, being a caretaker mother, I was ill. My mother-in-law, who was seriously ill, and everybody in my family, I was supposed to give medicines to everyone. आप क्या करते हो chemist में? जाके medicines पहचानवा लेते हो, right? When you are like not in quarantine. There were so many medicines written. I did not know what to do. If my doctor and my friend would have not helped me, I did not know how to manage at that time. Like Professor Aneja and everybody knows, like Dipender sir also knows that how badly we were suffering at that time. When I faced this kind of issues, I went and researched ahead. I talked to all the disabled mothers like me. I have worked with hundreds of mothers and asked them same question. What kind of difficulties do you face when your child is sick? Those mothers were like, Smriti, we don't know what to do. We don't have many times memory like you. Many a times we end up giving wrong medicines to our children. Many fatal accidents have occurred because of that. Let me be very, very honest with you. I have seen my children, my friends' children dying because of that. It's very hurting. And whatever I'm talking on the basis of truth, right? And then this kind of situation, when you see what could be the solution, we thought about it. So again, I was sitting with sir only, Dr. Matthew Hogis only. He said, if you can scan, if you can do everything, then QR code can be solution for medicine. I said, yes, sir. And then he said, if you can send WhatsApp, then one QR code, something is written on the medicine, that would be okay. Like many people will advocate to me that there is technology, Envision and all apps and like blah, blah, blah. There are many apps, Kibo and everything. They can read handwritten things. They can read everything. But imagine situation when strips are torn off. How are you going to read expiry date of the medicine if that medicine you don't have to have regularly? So that's the problem. So accessible tablet, accessible healthcare, and accessible medicine is need of the hour. If we care life for disabled, if we don't care, if we think survival, if we believe on the survival of fetus principle, then I don't know. We should not talk about accessible health then. Thank you so much.
Thank you, Smriti, and obviously very moving things that you've been speaking about. But yes, I think we do care. It's just that these things sometimes evade in terms of priorities, etc., which are now coming to forefront. And that is why actually we are having a dialogue. And I think we should all contribute to identifying the problems and working towards the solutions of it. So, but thanks a lot for your contribution. Actually, it is very, very important. And I think we will need more details to all the facts that you were sharing, because those are the facts that will actually move. Who knows? I mean, tomorrow we will be able to solve this problem, and we'll be able to move the right people in the right direction for this purpose. Friends, we have been speaking about highlighting the issues now. This is the turning point of this event where we will start talking about the possible solutions and various issues. Although these are all, I would say, these are baby steps, but important steps. And I hope in the right direction. We will know about all those when we hear about them. And also, yes, that as we have just actually reassuring message from Dr. V.K. Paul saying that yes, this will be taken up pretty soon at the highest level is a big assurance, and I think we should all work together to make it take it forward. Two things: the people who have joined us on YouTube may please give your comments, your stories, your experiences to strengthen our endeavor in this area. Whatever you can share, please share. If you have any questions for any of the presenters, please do share on the chat box. This will be taken up in the QA section at the end of the presentations. At this time, I would also like to announce that this particular session is going live on Radio Udan. So there are thousands of listeners of Radio Udan are actually accessing this webinar live right now. With that, as I said, the solutions part begins, and we would like to begin the solutions part with the launch of primer, the science primer, just to build the base right from the childhood, so that they are more aware. I mean, persons with blindness ourselves are more aware about our own anatomy and our whole, understand the health issues better for our science awareness and our awareness about our body itself. So we are launching a science primer here. Dr. Piyush Chanana, who will be actually be presenting the launch here, and our chief guest for the day, Mr. Dharyal. I would like to invite him to do the honors of launching this. May I first of all ask Anish, please introduce what guests, Dr. Piyush Chanana and Mr. Dharyal, please, before the launch.
Thank you, sir. Mr. T.D. Dharyal holds a master's degree in Economics and Business Administration from University of Hull, UK. He is currently the president of National Association for the Blind, Delhi, executive director of the Center for Accessibility in Built Environment Foundation, and advisor of disability in CBM. Mr. Dharyal has varied experiences as a civil servant for more than 3 decades in various ministries. Working for the rights of persons with disabilities is his passion, which decided his career path. He resigned from the civil services to be able to continue working as Deputy Chief Commissioner for Persons with Disabilities, Government of India, which he joined in 2002. Additionally, he has also worked as a member secretary of the Rehabilitation Council of India. After his retirement from Government of India, Mr. Dharyal served as the State Commissioner for Persons with Disabilities, Government of NCT Delhi. He passed many landmark orders covering most of the thematic areas concerning the rights of persons with disabilities. He was also disability consultant for evaluating all the schemes of Department of Empowerment of Persons with Disabilities in NILERD, Niti Aayog, Government of India, and National Consultant on Disability Issues in India for UNESCAP for preparing a case study on harmonization of Indian domestic laws with the CRPD. Mr. Dharyal has also compiled a book entitled Judgments on Disability Issues and contributed in bringing out publications on human rights regime for persons with disabilities. He has also presented papers on various disability matters at both national and international forums, and is also a guest faculty in administrative academies and institutes of public administration. Dr. Piyush Chanana has been an integral part of the Assistive Technology Lab at the Indian Institute of Technology, Delhi, where he held various research positions and played a central role in research, development, and dissemination of multiple assistive technology solutions for the persons with visual impairment since 2012. He has completed his PhD in assistive technologies from IIT Delhi. He's a co-recipient of a national award from Government of India for the best applied research product aimed at improving the life of persons with disabilities. He has been awarded the Neelom Prize for his work in the field of assistive technologies, an international recognition for creating positive social impact using science and technology. He's the co-founder and CEO of Race Lines Foundation, which is a not-for-profit organization incubated at IIT Delhi. Race Lines Foundation focuses on making information, especially diagrams, accessible for persons with visual impairment. He also heads strategy and innovation at Saksham. Prior to joining IIT, he worked as an assistant professor at Bharati Vidyapeeth's College of Engineering, New Delhi for 6 years, during which he was involved in teaching and research in the field of embedded systems and digital design. Thank you.
Thank you, Nishta.
So with that, I would like to now invite our honored guest, Mr. T.D. Dharyal, to please trigger off the launch of this primer.
3, 2, 1. Can you hear me? Okay. Yeah.
So I'll just talk a little bit about what this primer is all about. So this Tactile Primer is a comprehensive collection of more than 100 tactile diagrams that are required for explaining concepts related to general science. It is developed for students with visual impairment and blindness studying in classes 1 to 5 from all across the country, irrespective of school and the education board. So in this primer, we have included the tactile diagrams for the concepts that are extremely important, but very difficult to visualize and understand without the diagrams. And they are categorized into broadly 10 categories, and we have covered diagrams related to human body, animals and insects, birds, plants, food chain and food webs, then food and nutrition, clothing and housing, means of transport, our environment, then solar system and space. So the vision behind the development of this manual was to first ensure that these diagram-based concepts are available for the children from the primary classes itself. The idea is we should build a very strong foundation and help them acquire tactile perception skills as well as understanding of important science concepts from the very beginning. So by the time these students will reach higher classes, they will have the self-confidence and the skills to comprehend the complex diagrams also, which will ultimately lead to the freedom to pursue subjects and careers of their choice. And that's what we should aim for, because there is no question of intelligence or the capabilities. It's just unavailability of quality learning material, just like other sighted students have. So this is a step forward in that direction, where science is becoming more and more accessible for students with visual impairment and blindness. It's a long journey. We have reached this stage. So it involved in a lot of effort of teachers, special educators, and resource persons from Saksham, Xavier Resource Center for the Visually Challenged, National Association for the Blind Delhi, and the team of Raise Lines Foundation. They spent like countless hours in shortlisting and finalizing the conceptually important diagrams that need to be converted into tactile form. So ultimately, this rigorous feedback and detailed reviews played a vital role in improving the quality as well as making them apt for the sense of touch. It's a collaborative project undertaken by Saksham and Raise Lines Foundation. And the design and the first pilot production of nearly 100 copies of the Tactile Science Primer has been generously supported by Amway India Enterprises Pvt. Limited as a part of their CSR initiatives. So we are truly grateful for this support. I would also like to thank Mr. Raj Narayan, who believed in this project and supported us throughout the various stages of the implementation. Thank you so much. Back to you, sir.
Thank you so much, everybody. And yeah. Am I audible? Yeah. Okay. Thank you so much, Piyush, for this introduction, and thank you so much, Mr. Daryal, for the for triggering the launch. Please. Let's move to another part of the solution, and let me invite Mr. Rajat Banerjee from the Amway India Enterprises to share what Amway is actually doing in this area, especially in terms of the prevention of disability itself. So what is being happening and where we are. I would like to invite Nishtha to please do the introductions first.
Yes, sir. Mr. Rajat Banerjee is the Chairman, Indian Direct Selling Association and Vice President Corporate Affairs at Amway India Enterprises Pvt. Limited. He's the Vice President, as I said, of Corporate Affairs at Amway India, where he's been an integral part of the direct selling industry for over 2 decades. In this period, he has been part of IDSA's thought process, meetings with central as well as state governments, part of the international delegations, media interactions, and CSR outreach. He has been with Amway since April 2000 in a variety of roles. While the first 5 years at Amway were devoted to the company's CSR efforts, he was head corporate communications and CSR between July 2005 and April 2010. He has done his PGD in journalism from BBB Delhi. Prior to joining Amway, he was a journalist for 8 years in Delhi. Thank you.
Thank you for that kind introduction, Nishtha. I trust you can hear me.
Yes, yes.
Great. Thank you so much. I'll try to be brief because I think I'm a pygmy amongst giants. Because other than sharing Amway CSR efforts that my dear friend and colleague Raj Narayan kind of leads in Amway today. I did this about 20 years back. I have Manocha, Professor Anil Aneja of AICB. I just might quickly add that my initial years of CSR and Amway were working very closely with Kaul Saab, and I'm so glad that I could, connect to him today through Professor Aneja Saab. Professor Sanjay Jain, it was a delight to hear your views. Smriti ji, your real life situation, of course, as a speaker before me said, that truly touching. Dr. Piyush Chanana, Mr. Dharyal, Ms. Rumi Seth, and of course Raj Narayan. I repeat myself when I say that the points raised by Professor Anish and Smriti ji are reflective of the reality, and what I share right now is not even a drop compared to what I guess so many of us face on a daily basis. Nevertheless, we at Amway have tried to do a small bit. I mean, today's event commemorates the start of that, but I still feel it's a very tiny little drop compared to the work that you all do. And if you indulge me for a few moments, I just kind of deviate from the main line of discussion and share with you Amway's contribution towards in our CSR on the work that we've done over the last 2 decades plus. I joined Amway in 2000 April, and while the business operations started 2 years prior to that in May of 1998, I was delighted as a former journalist. It gave me a great pleasure to understand that this company started its work in CSR when CSR was not even known in India, quite honestly, way back in 1996, 97, even before they launched commercial operations. You must understand that it takes a company at least 4 or 5 years to get off the ground. So in that period of preparation, etc., Amway had commenced its CSR and kind of actually lives its motto of helping people live better and healthier lives. Here I'm happy to share that the very first project was what we called in Amway the National Project for the Visually Impaired. I'll give you details of that in a second. Subsequently, Raj and team, others in the team such as Jignesh Mehta, Anita, etc., have been closely involved with something called the Power of Five, which focuses on child malnutrition, livelihood programs for women, as well as entrepreneurship for women, as well as the sustainability element in terms of water conservation around a plant in Madurai. And some of you who've been to that part of the country would perhaps know that that's a kind of a water-stressed part of the country. And happy to share with you all that from the time we started our water conservation work out there, the water table actually rose substantially. I think it was, I forget the exact figures, but it from 200 feet, it came up to about 80 feet. It might sound like a fairy tale and a boast, but you'll have to indulge me. That's the data that my plant managers give me, and I suspect it is true. Well, our national project for the visually impaired, which today is a part of it, has been instrumental in providing education and some livelihood opportunities for the past 2 decades, as I did mention. We have helped, or rather worked in partnership with stellar organizations such as AICB, NAB as well. I think there was Mr. Kothari who was in the Bombay office when I used to work with NAB. I do not know if he's still with NAB, but he was a very, as Mr. Kaul is, Mr. Kothari was a very, very vocal advocate of causes for the visually impaired, and why not? I think from what I hear today, definitely this line needs very, very strong advocacy, and happy to be interacting with the group again after a long time. So we did about 15 projects covering 10 states in the earlier years. Braille textbooks for children that were provided all across the country, really. Oh, sorry, in 10 states, 15 projects covering about 10 states. And of course, we partnered with AICB, NAB, and the others to celebrate White Cane Day, Louis Braille Day, where we brought in the Amway personnel, the Amway distributor, just to sensitize, because, you know, most of us are quite honestly, I'm ashamed to admit, not very aware of the challenges that our brethren face. Of course, the work that we've done with AICB, NAB, Saksham, of course, has touched, Raj Narayan tells me, about 2.5 lakh lives, which is, I think, a decent number. But again, I still repeat, it's a very tiny fraction compared to the total figures that our country faces. And the other projects that we've done in terms of nutrition and wellness is aligned with the government's National Nutrition Mission, where we introduced something called Power of Five. I'm sure if there are any questions, Raj Narayan would be the right man to answer them. These are the talking points that that have been proffered as such. Of course, I'm aware of the work that he and his team have been doing. And of course, along with Saksham, we've worked on digitalization of senior secondary courses for NIOS, some select educational material in the social science and humanities section for graduation and post-graduation students on various central universities. And we've also, I believe, launched a mobile app to facilitate lives. And I do hope this app addresses some concerns raised by Smriti and Professor Aneja, because there is no point if a technology has no application. And I do hope that our contribution is contributing a bit in that sense. And of course, today here we are with partnering with Saksham on the Tactile Science Primer. And of course, I'll not elaborate or labor over the details because we've just got to know about it. But I'm glad that this will help in terms of covering the human anatomy, food and nutrition, environment, among the various other various other subjects that students obviously need. I mean, most of us take it for granted, but I'm sure this technology will help students definitely. Again, there are some details over here of the tactile diagrams, but I will not repeat them because Dhariwal Sahab has just outlined them. So I think from our perspective, all I can say is that corporate India, and in fact, society at large, not just corporate India, society at large does step in at times. I do admit, again, that it is just a drop in the ocean. But I'm glad that we are able to partner with wonderful organizations such as Saksham, and of course, AICB and NAB. With those, I'll hand it over back to Anish. Thank you so much.
Thank you so much, Rajatji, and of course your Amway's contribution by way of health and specific things on health and nutrition definitely goes a long way in prevention of disability itself. So plus all your we know Amway for a very long time as very good friend of persons with blindness and low vision, and helping us in many different ways in dealing with certain issues. For this.
That's a good fortune. That's a good
sorry, couldn't get that.
Sorry, continue, sir. You can continue.
Right. Okay. So with that, I think let's move to some other solutions that we let us know about certain other solutions states that we have, state of solutions rather I should say, that we currently have, and as I said, these are all baby steps in comparison to what really is the need when it comes to accessibility, but these steps are important as well. So may I again call upon Dr. Piyush Chanana to introduce a few of the solutions that do exist, and maybe I can also say that some of them have actually been lifesavers in these circumstances. So, Dr. Chanana, again, please.
Thank you, sir. So before I go to these solutions, I'll just take another minute to actually I missed showing some of the diagrams that are covered in this book, just to give a better idea to the sighted viewers or how these diagrams actually look like. Just 1 minute, and then we'll move to the solutions. Okay. Yes. Just a second, sir.
Dr. Chanana, may I, due to the, I think we are running slightly late in our schedule, so can we jump straight to it?
Okay. Yes. Okay. Just open. So typically these are the diagrams, and this is how they look like, where the outlines are embossed and textures are added for the better understanding of the concept. A simple thing like a sparrow, which cannot be touched, but how the beak of the sparrow is like, or the foot of the sparrow, or these. Then the growth of plants, how a seed becomes a full plant. So the various stages, very important to visualize with the help of tactile diagrams. So all these things are covered in detail, and these are some of the examples. So now we'll come to the important solutions, which can be something as basic as thermometer, but it's really important in today's scenario. So if a thermometer is there and you want to measure your temperature, so you're dependent on somebody else to read the reading. So if this thermometer has the audio output, then things become very simple. So this is example of a talking thermometer, where you turn it on and it gives you the indication that it is ready to measure. And then it gives a periodic beep indicating that, okay, the temperature is getting measured. It takes few minutes, like couple of minutes to get to the exact reading. So right now it's not in my mouth, it's in my hand, the mercury part. So it will not show the body temperature, it will just show a lower temperature.
Your body temperature is 91.5 degrees Fahrenheit.
And when the temperature measurement
Your
is...
body temperature is 91.5 degrees Fahrenheit.
So this is very simple, but this solution is available and can be utilized for the measurement of temperature. Then the next solution is again extremely important, the oximeter. Nowadays, measuring the SpO2 level is important. So there are a variety of oximeters available. So here we'll talk about the one with the audio output. So you turn on most of the oximeters are small rectangular devices, and on the top you have just one button to press. So when you press that button, the device turns on, and you have to insert your finger. It's like a clip. You have to press the clip from one side and the space will be created, and where you can insert your finger. And you have to place the oximeter on the flat surface after that. So let's see how it works. So finger is inserted properly. Then I'm pressing a button on the top. Once the reading is taken by the oximeter, it gives a beep to know to tell you, okay, the readings are now ready to be read. Again, you have to press this button. It's a tactile field push button. So when you press it, so it announces the SpO2 level and the pulse rate. So this is again a useful digital talking device for health parameters monitoring. Then we have another device where we want to measure the blood pressure. So it comes with a cuff, which needs to be strapped on the upper arm. And once you snug it properly, then you have to turn the device on. So let's see how it works. So with the strap, you have a thin pipe. You have to insert the pipe in on the left side of the device. It's a small hole. You can feel that. It's a round circular hole. You insert the pipe there, and then you place the device, which is rectangular box-like structure, on the flat surface. Then you have to take the strap in your hand, open the window, and just pass it through your arm. So that it just sits firmly about an inch above your elbow. So once it sits properly, then you have to press just one button, which is there on the main front side of the device.
Dr. Trust BP monitor is ready for use. You may start measuring.
So when you press this button, it will start inflating. It takes about a minute to inflate first. And then automatically it adjusts the deflation, and then it settles down to a final reading. Just a second.
Systolic, 131 millimeters of mercury. Diastolic, 87 millimeters of mercury. Heart rate, 91 beats per minute. According to the World Health Organization guidelines, your blood pressure is high to normal.
So these are some of the utility devices which are available through Saksham. Some are only available through Saksham, but others like this blood pressure monitor are available through Amazon also. It's just that we have to look for the interesting solutions and just evaluate them, that whether they are completely accessible or not. And if they are accessible, then we can use them. And all you can see in all these solutions, the only change that has happened is the audio output. Just with that, the whole thing has become accessible and usable to grant independence to a person with visual impairment. Then then because we are talking about medicines and other things, so let me give you another short demo of okay.
Scans. Clicks. No. Off. Cast screen to dim. Wireless display. Screen mirroring is.
So these solutions are typically applicable for the visually impaired users who are comfortable with using smartphones. And on smartphones, you have various apps which can be used for different purposes. Okay, so just a sec. Oh. Okay, so somehow I'm not able to project my screen, but I'll just give you an example of a Lookout app, which is a simple app from Google, a free app. And by default, when you open that app, it opens opens in text mode. And the text mode,
C.
you can use this text mode to read the medicine labels, especially on the syrups, etc. For example, right now there's a cough syrup in my hand, and I'm just
Closing parenthesis. G9E. P. New hour. Dextromethorphan. Dextromethorphan hydrobromide, phenylector hydrochloride and clofururant. 100 milliliters. Dot. A1741. 100 milliliters. 1410. Dextromethorphan cough formula. Hydrobromide, phenylephrine hydrochloride and clofeniram. Maleate syrup. Alex. Syrup. Anti-allergic. Cough really nasal D.
So this way, just by pointing my camera in the direction of the syrup, I'm able to read out the entire text which was there. And now I know, okay, this is the syrup for cough problems, and the name is this, and the quantity is this. All those details are there. But obviously, as pointed out earlier, this solution will not work for reading out the expiry dates properly, because sometimes it reads out just the alphabets, and then it becomes very difficult to interpret what it is talking about. For the name, it's easier, but for understanding the expiry, etc., it's difficult. Let's take another example.
AIHA. As. Pavan. 25 milliliters, 25 milliliters, 25 milliliters, 25 milliliters. Dossier osteoarthritis, lag cramps, 2 hunt shoulder and hepatitis, B-no. Expert in LIFESLE disorders. Same. Rumuscle, liniment, topical at ZANDU.
So it's a Rumuscle liniment from Zandu, and it is used for the pains, etc. So now I know that. So this way, the syrups are easy to recognize. Now let's see how this app performs when we are using the medicines. So now I have a strip of Calpol in my hand. Let's see how it responds.
Text. Laptop Plyushidi for UFAT nectrolusly. Text. Acetamol tablets I. Alpol 650. Tube packaged goods with text. Paracetamol overdose may be injurious to liver. Tube packaged goods with text. Store at temperature not.
So it is clearly specified that this is this is paracetamol tablets and 650 mg dose, and the name of the medicine is Calpol. Let's just quickly, before we go to the next thing, another thing is another medicine strip is in my hand. So let's see how it responds.
Text. Montative text. Cipia. Pentacel. Ibelsi Montasip LC Montasip LC Montasip. Dosage is directed by the physician. Cipla. Marketed by CIPLA Ltd. Cipla House, Peninsula Business Park.
So this is a Cipla medicine, and the name is Montasip LC. So this way, it's a partial solution, but yes, it works for some of the things. Interestingly, you can use this for identifying the food labels also, like different food things are there. So it has an option where you can go to food labels, and you have to download the data for the Indian food labels. And once you have downloaded the data for the Indian food labels, the app will start recognizing the various food things. Like it can be a muesli, it can be a Bonvita, it can be some honey, or even the green tea, etc. All these labels get recognized very effectively. So we'll not go into the live demo thing for the more examples. But another app I want to just throw light on is the 1mg app or the Apollo app. So these are the apps which give you the options to explore various medicines. Like these apps are accessible, and I can just search for a medicine and know its composition and all the details. And once I know all the details, then I have also an option to buy it online. Obviously, if you're buying allopathic medicines which require prescription, you'll not be able to order them without the doctor's prescription. But if you have the prescription, you can just click a picture, upload the prescription here, and you can download that. In addition, they give you an option for taking online appointments with the doctors. Plus, you can book various tests. It can be any test. You can just go to the app, go to a particular section, and order the test. Similarly, you can explore various food products, in general, food supplements or the other things. using these apps. So the crux is that there are a lot of challenges, but there is always a silver lining, and that's where we are heading towards, that these solutions have huge potential, and as they get mature and more users adopt them, they are surely going to benefit, and a lot of problems can be solved to a good extent. Thank you.
Thank you, Piyush. Thanks a lot for such useful demos. I'm sure this will, as I said, this is a starting point, but for his guidance and views now, may I also invite Mr. Dharyal, please, for you to share and guide us for the future action. Mr. Dharyal.
Thank you. Am I audible? Am I audible?
Yes, sir.
Thank you, Dipenji, and the Saksham Trust, Amway Enterprises Private Limited, and Raise Lines for giving me this opportunity to interact with you and understand how the technology can help in providing the health services, at least the services that are available to people with visual impairment and other disabilities. I must acknowledge the contributions of very passionate, committed, and learned people like Dipen Minochaji himself, Dr. Sanjay Jain, Professor Balakrishnan, who has done so much for people with blindness, Professor Rao, Professor Anil Anilaji has done so much advocacy, and we all have learned so much from him about the issues concerning people with disabilities. Today's talk was really an eye-opener. To at least me, I did not imagine these problems that the people with blindness, but for him and Smritiji. It's a great contribution of Amway. Rajatji explained how Amway started the CSR even when the CSR didn't exist. Piyush, your contribution and the way you have associated yourself with Saksham and other disability issues and organizations indicates your unstinted commitment. Thank you for that. If I miss somebody's name, please excuse me. But I'm really thankful to everybody out there in the YouTube who are watching this, Radio Udan, because all these things need a lot of awareness among people with disabilities. Many of us did not know about what is available and would know only if these are available in an accessible form to people with blindness. Dr. Sanjay Jain's and Anil Nijaji's account of the legal position of the law of the issue, so important issue of healthcare facilities, products, and all these things. An interpretation of Section 25 of the Rights of Persons with Disabilities Act 2016, comparing with Mental Health Care Act and the UNCRPD. Really, these are the things which should be brought to the notice of the authorities, those who have drafted these laws. when it comes to, say, ensuring health services free or whatever, my observation is that whatever is available in a country, whatever is available for other people in the country should also be available on equal basis to persons with disabilities, especially people with blindness and low vision. So, unfortunately, in this section, I don't see on equal basis with others. In most of the sections of this Act, Rights of Persons with Disabilities Act, I see on equal basis with others, but not here. That's one. But in whatever way I have the law available to me, I thought, how can I make best use of it while I continue my efforts to improve and to point out whatever the shortcomings are. It will take a lot of time to amend the Act. So I want to get best out of it. So I thought, we should, I think, examine, and we should benefit from the guidance of Dr. Jain and Professor Anish, that I link this section 20 health care facilities and the provision in the RPWD Act to the Honorable Supreme Court's interpretation of right to life with dignity. So therefore, it is my fundamental right. To what extent shall I be able to get benefit out of it through courts is a different matter, but something I'll get. So that's one we have to probably point out those shortcomings of the laws. And then a very important thing that we talked, it was also told that the digital mission, National Digital Mission, Health Mission, doesn't talk about the needs of people with disabilities, particularly people with blindness, who have so many challenges that other disabilities, persons with other disabilities may not face. So that mission should mention all this and provide for it. Probably is the right time. I think it was launched in September 2021. So there is a need for advocacy on this to write immediately to the Ministry of Health and Family Welfare for this accessibility, for these issues. And second important thing I feel is that within the disabilities, we have, say, women with disabilities. Women with disabilities, women with blindness and low vision have their own different kind of challenges that perhaps males would not face because of the multiple disadvantages they have on account of their being feminine gender. So their gender-based discrimination combined with the disabilities also have a lot of issues, particularly during this pandemic. This is I will call it a very crude observation that many women with disabilities, including, of course, with blindness and low vision, could not avail the quarantine facilities because the toilets were not accessible. because they thought the provision for them is not there. So that's one, the accessibility of things, physical or otherwise, even the existence of those things at times is not there. Accessibility to the hospital or that, maybe they are physical, but then so many other accessibility issues are there which really need to be addressed. Of course, Dr. Paul, who is so sensitive and so kind, and is willing to help us. I think these issues should be brought to the notice of Dr. Paul, and the issues of a particular segment, say young girls with blindness and low vision, the women who have acquired blindness later in life, particularly after marriage, their conditions, their challenges to access health or any other facility are very, very huge, and perhaps not noticed by most of us because it doesn't affect us. This is a as far as this solution is concerned, this should require creating awareness among the people, the say primary stakeholders, and also the education departments, Government of India, Department of Empowerment of Persons with Disabilities. Can these be aids and equipments under the ADIP scheme, SSA ADIP scheme, what they used to call for education or for other things? So why can't ADIP scheme or any other scheme of the central government or the state governments include these items to provide to people with disabilities for blind and low vision? That is one. The third point that we can perhaps request the ministry. And then marketing is very important. Yes, most of the people nowadays go to access things, buy things from Amazon. That's what awareness, ultimately creating a market for the products, and then simultaneously also creating the capacity to meet that demand. That of course you would better appreciate it. Last point I have, which is always in my all talks, I talk about it, and very, very forcefully, right from the policy making to wherever, that education or something in the ministries, to implementation. That is this nearly 70% of our population or persons with disabilities in the rural and remote areas. How can we make all these solutions available? How can we make the healthcare facilities available to those people in the rural areas, in the remote areas, and to the people who are not fortunate to have received education, enough education as we did? It is many people from rural areas, remote areas, poorer backgrounds have also received good education, good positions. They may not have good money, but many of them, majority of them, do not. Illiteracy, poverty. So our solutions, how can we reach out to those people? Saksham or Amway or Raise Lines alone, or NAB or AICV alone would not be able to reach out to such a large swaths of geography in our country. Such a large number of people. So we really need to take it up with a lot of effort and very effective advocacy with the governments, backed by the arguments that Dr. Chen and Professor Anish has brought out. Let us tell them these are the lacunae, but then these are the solutions. At least it can reduce the impact, negative impact of a bad law. So let's ask, and also if you want to have anything implemented, anything new initiatives that we need, or implementation, particularly implementation needs at least these three important things, that is cooperation, coordination, and convergence. So the government must be, I think, brought in the loop so that a larger section of our people with disabilities, blindness and low vision, or deafblind benefit out of it. Thank you very much. Once again, I thank the three organizations, individuals who have given us this opportunity to be part of it, and my best wishes for the achievement of the intention or the aim, objective of this webinar and the solutions that have been presented today. Thank you so much. God bless you.
Thank you so much, Daryalji, and as always, I mean, you've been such a guiding force for us to take things forward and to guide us in the right direction, and really giving that impetus and being part of the system. I think you've really been a person who knows how to scale it up. We obviously are looking at building good models, but as you just said, I think we need a lot of efforts to take things forward for scaling up and for reaching out to the masses here. Thank you so much, and we really look forward to your further interventions and
most welcome. Most welcome.
With that, I would also now like to acknowledge and call upon two of our very special guests who have joined us today, Professor Madhusudan Rao and Professor Balakrishnan. So may I invite Professor Balakrishnan from IIT Delhi to please come and share your thoughts and your reactions to whatever we have heard here today, and what are the possible future directions that we can take to come up with solutions. Professor Balakrishnan, please.
Thank you. Thank you, Dipender, and thank you all the organizers of this event. So it was many interesting both comments as well as views of both users, and actually also Pier's presentation of all the solutions. So of course, being associated with academics, so I strongly feel that in finding these solutions, working with organizations like IITs, academic institutions like IITs is very important. And in my own work at Assistech, where myself and Professor Rao have been working along with Dipender and others, what we have found is that these are the type of problems which technology students take it to and get really excited about it and are in a position to deliver. So we should use this both their abilities as well as their let's say competence and their excitement to be able to make a difference. So this is something small that we have been attempting at Assistech for many years now. But there is also, just like Dhariwal was talking about scaling. So the scaling, this part of it will also be a very interesting challenge. How do we involve more and more institutions and more students so that they are able to work in the assistive technology space? So through our initiatives like Empower Conference, we have been trying to do that, take it to various institutions and involve a larger academic community. And it is happening, but I suppose it has to happen at both at a much higher level and also at a much faster pace to really be able to make a difference in a shorter span of time. So with that, I will end my comments. And again, I would like to thank all the organizers of this event for an excellent program. Thank you.
Thank you, Professor Balakrishnan. And now over to Professor Rao, Professor Madhusudan Rao, for his comments, please.
Good evening, and thanks for inviting me. This was a wonderful session, and there are so many learnings from this session today. And special thanks to Amway for supporting this endeavor. And our association with actually Saksham goes back to more than 15 years. So whatever R&D which we do at IIT Delhi becomes more meaningful because we are able to take our products and innovation to users because of our involvement and association with Saksham. So thanks for that. And we are also happy to be a part of Science Primer, which is released today in a small way. But more importantly, some of the challenges which are faced by people with disabilities in accessing health care were pointed out by Professor Aneja, Professor Jain, and Professor Singh. This is really something which probably we would like to take it seriously. As the world is moving more towards digitization, it's a good opportunity basically for us to make this healthcare information particularly more accessible. I think some of the things which can be done is more related to prescription diagnosis, hospital procedures, test results. Many of them are going through digitization, and it's a good opportunity to see that when they are being designed, they are also made accessible. We'll be very happy to take up some of these challenges as a part of our future work. And I think one of the probably primary approach coming from Department of Design is to probably strive for more universal design is a first approach. Whatever products and solutions which are being designed, if they also have features which makes it accessible to people with disabilities, that would be a first priority. If it is not, then probably assistive technology can probably make it happen, would be our this thing. But let me also tell you that technology is a very small component in addressing this problem. As Mr. Daryalji mentioned, that we also need to probably do a lot of policy and advocacy work, which was there. And we will also try to, whatever we learn today, pose it to Ministry of Health and World Health Organizations in our future meetings with them. But I feel a more design thinking approach where we do an inclusive design of products and solution should be able to solve many of our problems, and we'll definitely take some of these work ahead. Thanks for this opportunity.
Thank you, Professor Rao. And with both of yours, a close association with ICMR and WHO and AIMS, I think we are looking forward to a lot more solutions coming out of your interventions to a lot of these problems that we have been speaking about. In conclusion, I would like to actually just say that the problems that have been highlighted today, and especially because of the COVID, what happened was that COVID actually took, in a lot of instances, took away our assistance, because we were safe, because if there is no accessibility, direct accessibility, we would rely on assistance. But COVID, getting infected with COVID meant that we would not want to put lives of our assistants in danger, and thus would not want them to be close to us, and which meant that we were then left to fend for ourselves. And for things like during those 9 days of hospitalization due to COVID or other things that have been highlighted by presenters today, I think it has brought a completely new definition of what access to health services really mean, and what really where the key gaps, big gaps there are, and how we sort of need to address them. And also to say that actually the right to the accessibility to health is almost next to the right to life, because right to life is what gets endangered if the accessibility to health is not there. If there is a gap there, there is a danger to right to life itself, which obviously is much above all the other rights that we talk about. And I think it's a good beginning. It's a good beginning of the dialogue on such an important initiative. In very recent future, we are going to come up with the report of this particular webinar. We want to take it up with the authorities for policy, but we would be working very closely with the institutions, IIT Delhi and the institutions, for building the solutions that can actually be scaled up for its deployment with government policies, etc. And really looking forward to addressing this critical issue in partnership with all the like-minded and critical organizations such as AICB, etc. So with that, and with special thanks to Amway and all the participants of the webinar today for spending so much of your time, for sparing this time for this event today. I would now like to close this event for the day.
So before ending the meeting, I would request you all to please switch on your camera for a minute so that we can take a picture.
Okay, so my video is on. So
yes, you are visible.
Yeah. Well, I guess all this is also important for our documentation and spreading the word around to build awareness across this critical issue.
So happy to see professors from IIT. Namaste.
So let us know when the photography.
Yes, we are just yes. Ashwin, are you done?
Thank you. Yes, it's done. Thank you, everyone.
Okay, thank you very much.
Thank you, everybody, and
Thank you, everyone.
Depends on one thing. If we want to buy these equipments, are they available in Saksham, the equipments which were just displayed?
Yes, sir. So like thermometer, pulse oximeter, all these are available. And the one I showed for the blood pressure monitoring, it's available on Amazon. So it's a standard product from Dr. Trust.
So maybe I will contact you.
Yes, sure.
Thank you very much.
Thank you, sir.